but a little bit thicker, a little nicer. If you open this kit first and you decide to use this one first, you could potentially just leave it as long as you keep your eye on your sterile field. Okay. And then you can choose to either put your stuff on your patient, or you can choose to put that field somewhere else. I just like to do everything up here. Okay, just it's easier for me. So the contents that are in here, let me just show you what they are. You're going to have your split dressing. It's going to be dumped on here. You're going to have some 4x4s so that you can clean your face plate with. Those are going to get dumped on here. You're going to have pipe cleaners. You're going to have cotton tip applicators. You're going to have a brush. And you're going to have these ties. You rarely see these anymore. We now pretty much see Velcro. We don't see too many ties. And the reason why is probably similar to how some of the trachs that are in here are tied. They're not tied like in a knot. They're tied like like your tourniquet, to where you can undo it quickly. All right? Never take trach ties completely off before having new ones on. If a patient would cough hard, they could potentially, have that trach come out. So make sure that you have the new ties on before you take the old ones off. Okay. All right. So I'm just gonna. This has a Velcro one, so I'm just gonna bypass this for right now. All right. Next, you're gonna want to make sure that you have some type of sterile water so that you're able to clean this. You can use this here as your sites. There's 3 parts to this. So if you fill, you need at least 2 of them filled. A lot of times people will just go ahead and fill all of them because once you have your sterile gloves on, you really can't touch it again, right? So this is a good soaking spot, and one of these is a good rinsing spot. Okay. So this is brand new. Couple different ways to do this. You can at this point go ahead and take out the trach that's in here. This is a disposable one, so this skill eventually I think will go away, but we still have to teach you it because there are patients who have reusable ones. This one is not. So literally this skill would be remove, trash, open a new one, put it in. But because there are some that are still hanging around with these, we need to teach you how to clean it appropriately. Okay, so these go in the same. They actually have like a little, you pinch and it releases them. These have a locking device, so when you put it in there, you turn it and it locks, and then you unturn it and pull it out. And like I said, these ones are just, you just squeeze. Okay, these are inner cannulas. The outer cannula is still in there. It's just this. Oops, excuse me. This part of it. This part of it that you're disposable or cleaning. Okay.
And you're wearing clean gloves for this recently.
Yep.
Okay.
Yep. You could just take. You can just use clean gloves right now if you're choosing to take this out and just have it soak. Okay. Some nurses you'll see that will go ahead and contaminate one of their hands after they get their sterile gloves on, just like they were with suctioning. So they'll go ahead and remove this because this part of it is not sterile. It's this part that's sterile. So when you put this in somewhere to clean, as long as you're picking it back up with the hand that you already contaminated, it's fine. So it's just a matter of preference of how you want to do it. So you can either take it out and drop it in and let it sit and go ahead and sterile up, or you can go ahead and sterile up and take it out and have one hand that's not sterile. Okay? Whatever preference is. All right, so we're going to go ahead and don our sterile gloves. Reach in, grab. this point in time, we need to clean what's in here. So you can either choose to use, you can either move this to the patient, or you can just work in this area. Whatever you want to use as far as cleaning. So you can use pipe cleaners. And it really just depends on how much secretions are dried in here. Sometimes you'll pull them out and they look pretty clean and you really don't have to do a lot of cleaning. Especially if you just suction, it's going to be way easier.
Is your left hand now not sterile?
Well, technically, it shouldn't be, but it still is.
It is sterile.
It is sterile.
In theory.
I guess the rationale behind that is it's in sterile water. So I don't like to cross-contaminate. So once I touch this, I won't be like this. I just will keep my hand on this end. After you clean, you can choose to use the brush. If there's anything else on it, this brush won't go up inside here. You really need to use the pipe cleaners for that. But sometimes they get kind of like a little bit of gunk right here that you might have to actually use this brush for. Okay.
Do you rinse it at that point?
Yep, you're going to rinse it. Sorry. Yes, you're going to rinse it. Get all of those out. And then you can go ahead and go right in. I always like to go in kind of at an angle and then drop it in. Okay. Because I feel like if I aim it this way and you're pushing, this can hit really easy and that's, you know, contaminating your site. So I always try to go in here, and once I get it actually in the tip, then I turn it and push it in. It's just preference. It's just saved me a lot of times from having to re-clean it. Okay? Questions? At that point in time, you can clean your face plate. We're not going to go through those steps right now. So you can use this to your third slot there. You can get it wet. You can take your fluid and pour it on it. However, there's no more sterile anything now. So you can clean your face plate and then change out your ties. Okay? I would keep one of these to dry it off. Okay? You want to keep at least one to dry it off. And then you'll go ahead and put your dressing back in.
Does it have to be sterile or just?
No, nothing is sterile now.
Okay.
Only thing that was sterile was that inner cannula.
Okay.
Questions?
Where did you place the last pad? What was the last pad thing you were doing?
This is your split. So your split goes either this way or this way. There's not a right way, so it doesn't matter if it's this way or this way. It's whatever really the patient prefers. Most patients will prefer it this way, but some actually like it this way because, especially if they have a beard, they prefer it this way because it doesn't like get down into that that trach area and irritate as much. So it's really just what, you know, and the patient will tell you. If you do it wrong the first time, they'll say, could you turn that around? Yeah. Yes?
So that's the changing of the pad is the very last thing that you do. Is that correct?
Yes and no. What I mean by that is some people will go ahead and put the pad in and then change the trach ties, and some will put the trach ties on and put the pad on. There's not a right or wrong way.
Okay.
The only part that is that you could do incorrectly is breaking the sterile technique of this skill. Yes.
And changing the ties, you said you tie the tie on both sides of the faceplate before you take off the old tie? Or no?
Technically, you only have to do one side,
Okay.
but I've never had a tray come out on me, and I don't ever want it to.
Right.
So